Guys, so this is a 62-year-old male. He's a friend of mine with chronic knee pain, medial aspect, kind of at the joint line. And so he was kind of struggling, not having any relief with conservative treatments, did not want steroids or gel. So we decided to get an MRI and see if he'd be a good candidate for injection. We found kind of some things that we would expect, like, and we had seen on ultrasound, medial meniscus complex tear. I was looking for bone marrow edema. He does have a small, tiny bit of bone marrow edema right in here at the medial tibial plateau, which correlates to where he has pain. And then we also saw his ACL had some mucoid degeneration, no real instability, no tears as far as he was aware, and negative anterior drawer. But I told him I wanted to treat that with an injection of PRP. Then the only other thing we saw in him was this kind of Baker cyst, but it's really not a Baker cyst. It's actually a ganglion cyst from the tib-fib joint. So it's coming off of this tib-fib joint here, and we could see that pretty easily with ultrasound. So I told him I wanted to drain that and then also inject the tib-fib joint, since that probably is the source of the fluid collection there. And that's a big gelatinous, thick fluid, so you can't really aspirate that through a small needle. So we used an 18-gauge needle to aspirate that with ultrasound. So anyway, we're going to show you these different places where we injected under fluoroscopy and ultrasound. We use leukocyte-poor for intra-articular. We use leukocyte-poor and a little rich for the tib-fib joint. I used leukocyte-rich for the ACL. Then we did a little intraosseous injection for this medial tibial plateau. Leukocyte-rich for the disc for the meniscus as well. So anyway, we'll show you these things in the video. Thanks a lot.